The Hereditary Neuropathy Foundation was created to help those affected by Charcot-Marie-Tooth, the most common hereditary neuropathy. H&F's mission is to find treatments that will halt, reverse, and ultimately cure CMT. CMT is a progressive debilitating neuromuscular disease that causes extreme fatigue, muscle weakness and atrophy, foot and hand deformities, and mobility issues. It makes it difficult to do such simple tasks as buttoning a shirt, zipping pants, and caring for your children. You can no longer enjoy simple pleasures like walking on the beach. In the worst cases, patients develop deafness, vocal cord paresis, and breathing complications. CMT affects 1 in 2,500 in the USA and close to 3 million worldwide. Yet there is a pervasive lack of awareness that can result in misdiagnosis and contraindicated medical treatments. Our top priority is fostering research collaboration among academia, government, and industry in order to cure CMT. Our immediate objective is to increase awareness and proper diagnosis of CMT. Our clinical patient registry, the Global Registry for Inherited Neuropathies, or GRIN, will provide a rich database of potential patients for clinical trials. Next, H&F has developed a collaborative working group that will develop 2 essential outcome measures specific to CMT. Finally, H&F is funding exciting research using high-throughput screens of tens of thousands of compounds to identify potential therapeutics. We're also funding the development of cell-based assays and animal models. CMT is unfortunately a relatively unknown disease. Many patients and families are unaware that they have a genetic disease in the family and are at a great risk of medical complications due to lack of proper diagnosis. H&F is leading the movement in CMT awareness. Our awareness campaigns include national distribution of the documentary Bernadette, which tells the heartfelt story of a young woman living with CMT. Our school outreach program offers an engaging chapter book series featuring a spunky heroine who lives with CMT. Finally, our comprehensive social media strategy strengthens our community and raises a collective voice to support CMT research. H&F brings a unique vision of collaboration to the search for a cure for CMT. We believe that collaboration is the key to efficient and successful cure-driven research. Collaboration is also the key to raising awareness and strengthening our community. Not only does a person with CMT face innumerable challenges each and every day, but too often they face these alone. H&F understands that a single non-profit organization will not cure this disease, and this understanding allows the cooperation necessary to raise awareness, support those living with the disease, and to one day end its progression. H&F sets out specific targets and timetables for all research partners. We also require collaboration among our scientists to ensure the most efficient progress toward a cure. Finally, we track the effectiveness of our awareness campaigns through online metrics and our increasing database. Our high standards will produce the best results for the CMT community. To date, H&F has been seen more as an advocacy organization and not a research-focused organization. Like with any business, a foundation needs to develop a long-term strategic plan before diving in, particularly when we're putting our donors' dollars to work. We at H&F have spent considerable time doing market research, patient outreach, and implementing key industry collaborations so that we can most effectively and efficiently find treatments and a cure. We're proud of the establishment of the National CMT Resource Center, funded through the Centers for Disease Control and Prevention. The CMT Resource Center is an online portal providing education, training, and dissemination of information for those affected by CMT, their caregivers, and healthcare providers. On the research front, H&F funded the development of 2 cellular assays for the most common form of CMT, CMT1A. These assays have been used to identify novel small molecules which can be further tested. In addition, we funded the development of a CMT2A mouse model, which will be used for proof-of-concept studies for novel therapies at the Burke Medical Research Institute. Finding a cure for a rare disease that is relatively unknown is an uphill battle. There can be a lack of urgency and support for cure-driven research, except by those directly affected by CMT. Thus, H&F had to develop a two-pronged approach: awareness plus research, along with the pursuit of a strategy based on collaboration. We know that by cooperating and sharing information among multidisciplinary partners, as well as with patient advocacy organizations covering other rare diseases, our relatively unknown battle will become a common one, and our collective voice strengthened. With additional resources, H&F will expand upon the compounds already being tested for therapeutic potential. The more compounds tested, the greater likelihood of discovering a beneficial treatment for CMT. Once key factors have been identified, H&F has access to the assays and animal models in which to begin testing for therapeutic potential, though these projects will require additional funding. The final stages would be human clinical trials, and H&F is strategically positioned to lead these projects, having developed a rich clinical database of CMT patients. Bringing a drug to market is a daunting task. It generally requires years and millions of dollars. H&F's strategy is to lead collaborative research efforts so that our donors' dollars have the maximum impact. Additional funding will provide the foundation for such efforts and will allow us to implement our research strategy through to human clinical trials. There is also a dangerous gap in awareness of CMT, which puts patients and families at risk for contraindicated medical treatments if correct diagnoses are not made. With additional funding, H&F could improve public awareness and training for medical professionals so that no one goes undiagnosed.